So here's a repeated theme. By now you've heard this story quite a few times, and here's yet more evidence. We have access issues to the health system that need to be remedied if we're going to have an impact on HIV numbers and on access to mental health services as well. And those lack of access issues do have real effects. So there's research done on the sexual health of gay men that's pointing out that it means some basic things like they're not tested for STIs in the right sites. And if they're not being tested in the right orifices, they're not, their sexual health is not going to be as good. And it's also going to help facilitate HIV transmission. So where do we go from here? The argument I want to make is we need a gay-friendly, or even better, an LGBT health center in Toronto. And they exist in other places, in major US cities. Ottawa is making tremendous advances that we can learn from, and I think it's time that we get more organized. There are services here, look at all of the talent and labor in this room that are delivering excellent services, but it's not always well connected to where the need is, and we've got access problems. My bottom line there is our motivation in working in the HIV field is that HIV is never a single issue. HIV is just an index to a whole bunch of other issues, physical health issues and mental health issues. And if we're going to make any kind of headway in bringing gay, bi, MSM to an equitable health standard that the rest of the population can take for granted, we're going to need to have a systematic response. And we're inviting you all to be part of making that more systematic response to the mental health and addictions needs. So thank you.